From Eyewitness News, this is Newsmakers.
Welcome to Newsmakers. I'm Tim White. Ted Nesi will join me on the second half. If hospitals are the front lines in this viral war, then nursing homes are the trenches. No demographic has been hit harder in this pandemic than that one, especially in Rhode Island. So this week, a conversation with the head of the Rhode Island Healthcare Association, which represents the majority of nursing homes in the state. An important note to our viewers, this interview recorded with Scott Fraser happened on Thursday. Scott Fraser, President and CEO of the Rhode Island Healthcare Association, thanks very much for joining us. And I want to dive right in. Obviously, nursing homes are front and center during this pandemic. Scott, if you could, just to set the table, briefly explain to people who your organization represents and what it does.
Tim, the Rhode Island Healthcare Association is the trade association representing the majority of nursing homes in Rhode Island. There are 81 nursing homes in the state. We represent 64 of them.
When you take a step back with everything that nursing homes are dealing with right now, Scott, what is the biggest challenge facing these facilities right now?
Well, there are many challenges that we're facing, and that's certainly the first and the biggest challenge is keeping the virus out of our homes, because many homes have been successful at doing that. But if the virus is in the homes, then certainly isolating it as best we can, isolating the residents who may have contracted COVID-19 and protecting the staff as so that would be our first and foremost priority. Other challenges we're looking at is when a home is affected by COVID-19 or staff are test positive or may have been exposed, then staff will be certainly having to head home for a period of days until they're asymptomatic. So staffing is an issue there. PPE is an issue. Funding is an issue because, as you know, costs for PPE have gone up, costs for staffing have gone up. So there are multiple challenges that our homes are facing.
Let's dive a little bit more into the staffing issue. The data shows, Scott, that, as you point out, staff members are also contracting the virus. They can't come into work, or they shouldn't. We're also hearing about people that work in nursing homes, and frankly, they're afraid to show up to work. So when you say staffing is an issue, how big an issue is it? And are we talking the governor should be calling in the National Guard or something to help staff these nursing homes?
Jim, when we look at it, and some of our members have homes in other states that have been severely affected, and when COVID-19 comes into a home and affects the staff, we find that on average about 25% of the staff will have to be staying home to quarantine either because of their direct exposure or their indirect exposure. And then we also find that approximately another 20% will stay home because, as you say, they're concerned about contracting the virus or bringing it home to the families. So from that standpoint, that is why we have been asking for strike teams to be developed to assist a home if they get into a severe staffing shortage, a severe staffing problem. The strike team would be, as you say, National Guard, DMAT. There are a number of sources that we've been calling on to be put together. And it wouldn't be just medical people. We're looking at folks who could be an RN, who could be a CNA. Obviously, there's been the Rhode Island Responds website. I think more than 3,000 people have volunteered through that. More than 800 people have been granted temporary licenses to practice in the state. So those are great sources of medical staff. But certainly the National Guard, DMAT, other volunteers would be needed because when the illness hits a home, it's not just the direct care medical staff that are affected. It could affect our maintenance staff. It could affect folks in the kitchen. It could affect folks who work in the laundry. So we're looking for, when we talk about a strike team, we're talking about not just medical, but volunteers that can come in and assist in the day-to-day operations of our nursing home.
Well, and a lot of people at home listening to this might think that's a great idea. Has the state been responsive to that idea?
We've been working with the state. We have presented a number of proposals, and I'm told as we tape this that there will be some strike teams put together and possibly announced as early as tomorrow at the time of this taping, but hopefully before this program airs. And our hope is that it will include some members of the National Guard, of the emergency group DMAT, and of a group of volunteers. So we know our concerns are being heard. Obviously, from our standpoint, we would like action immediately. We would have liked to see some of these strike teams sooner than this, but we know the state is pushing forward to try and address the needs that we brought out.
I want to stick with staffing here, Scott. We are aware that a lot of these nursing homes use third-party agencies to hire registered nurses and CNAs to fill shifts that might be vacant. We see this. The veterans home does this a lot, meaning. Look, some nurses, some staff members could work at multiple facilities throughout the week. Do you think this has contributed at all to the spread of the virus?
Well, I don't think those facts are in, but I do think that that's something I know the State Department of Health has been looking at. Over the last few weeks, they've been trying to get a list of the employees that work at multiple homes. As you know, we test every staff member before they start their shift. When they come into our facility, we check their temperature. We ask if they've had any contact with anyone who is COVID-19 positive, if anyone has been exposed to it. We do that with every staff member before every shift, just to make sure that they don't have any symptoms. But again, from the state standpoint, I know they are concerned about staffers that are working in multiple homes, because that's the insidiousness of this illness. Is you can feel fine, you can test positive today, you can test positive for several days, test negative today and test negative for several days, but still be carrying the virus. So that's why rapid testing is important of our staff, multiple testing every couple of days to see if anything has changed. We think that's very important, keeping the disease out and keeping it under control when it gets into our homes.
We're speaking with Scott Fraser. He is the president and CEO of the Rhode Island Healthcare Association, which represents the majority of nursing homes in the state of Rhode Island. Scott, we've been getting this question a lot, so I'm just going to ask it of you. And I believe the governor was asked this week as well. But, some people wonder, should nursing homes be equipped with ventilators, since they're the ones that need it most? Is that even a medical possibility to put ventilators into nursing homes, or does the personnel that is required to operate those, is that prohibitive to make that happen?
Well, I think that would depend on each home and what their capabilities are. For instance, we do have one home, one of our member homes, which is in the old Women and Infants Hospital, that has 10 rooms that have oxygen in the room. And that's not something you see in every one of our facilities. Our facilities are able to maintain very good medical care and provide a lot of medical care to our residents. I think if one of our residents get to the point where they're in need of a ventilator, they would certainly be transported to the hospital so that additional care could be given. And we are always looking at the best level of care for our residents. And if they need a ventilator, there's certainly ventilators available in the hospital, so we would make sure they were transported at that time. But it certainly would depend each individual home and their capabilities.
Always want to be careful when giving statistics for an interview that some people might be watching days later. But you and I talked on Wednesday as well for a report, and as of Wednesday, something like 60% of nursing homes in the state had at least one confirmed case of COVID-19. And Rhode Island per capita is getting hit harder with nursing home residents than a lot of other states. Is there something unique about Rhode Island that makes this state stand out when it comes to cases in nursing homes?
Tim, I think there are a number of factors. And one of the factors is Rhode Island is known to have a very high proportion of folks over the age of 65 in our population. But we are also, I believe, number 2 in the country for the number of residents over the age of 85. And when COVID-19 first started, it was stated that this disease would hit the elderly the hardest, and it would hit those with compromised health systems and immune systems the hardest. And when it came to Rhode Island, we were told that it was going to hit congregate living settings the hardest, and all 3 of those describe nursing homes. When you look at our nursing home facilities and the residents in our homes, most of our members, most of our residents have some type of underlying health condition, or else they wouldn't be in one of our homes. They would be able to be either taken care of at home or in an assisted living facility. But many, many of our residents will have something, maybe diabetes, will have high blood pressure, hypertension, COPD, some breathing issues, kidney issues. So there are a number of underlying health concerns, and when COVID-19 gets in, it certainly affects those who have serious underlying health issues. I have also heard from my colleagues in other states that, I think to Rhode Island's credit, our reporting is right up to date. Our testing is as as up to date as we can get. But in other states, some of the reporting has been delayed so that if somebody had passed away, it may not be attributed to COVID-19 right away because that resident was not able to be tested. So I think because of the high quality and the proper level of testing and reporting, or at least the proper level of reporting, I should say, I think that's why you're seeing so many of the deaths occurring in our facilities. But it's congregate living, seniors, and folks with compromised health systems all unfortunately play a part in those numbers.
We just have a couple of minutes left here, Scott. So I want to actually ask you a direct question from our one of our viewers. And this person writes in, my dad's in a nursing home. His Social Security check goes directly to them. Does that mean they get the stimulus check also? And Scott, we've gotten this question a lot. The veterans home gets 80% of a resident's annual income from whatever source it is. I know you don't represent the veterans home, but that's how it works in a lot of nursing homes as well. Do you know the answer to this person's question?
We follow the state guidelines for Medicaid, and we do what Medicaid's directive is. And last night I've been asking this question because we're hearing it from a number of our members as well. And I was told that the stimulus check is treated the same as a tax refund or a rebate by nursing homes. And this is from the state. The rebate is not treated as income or as a resource in determining the individual's eligibility or assistance amount under any federally funded public program. So if I could translate that, I'm not speaking for Medicaid, but my understanding of that is that goes into the resident's account, and it's not counted towards income, it's not counted towards eligibility. Because one of the fears was, if that is counted as income, would that push someone over the limit and make them ineligible for Medicare? And then when they spend that amount down, they'd have to reapply for Medicare again. And as you know, this can be the subject of a whole different program, but the issues that our homes are still having with UHIP are many. And so we would not want to have to see a resident go through that. So that's what the answer was from Medicaid last night, and we will follow the directive of whatever the state tells us to do.
Well, and that would be consistent with other federal programs. We were told that the stimulus does not count against the SNAP, or as people know it to be food stamp benefits. So that, again, that would be consistent there. All right, Scott, final question to you here, and you might not be able to answer it. What do nursing homes, or what does the nursing home industry look like on the other side of this pandemic?
And that's something that we have to think about. I mean, right now, we're in the midst, as you know and can understand, of keeping it out of as many homes as we can. And when it gets into our homes, doing our best to contain it and protect the residents. That's our first and foremost goal, protecting the residents and then protecting the staff. But certainly that will lead to a number of conversations as to what can come out of this on the other side. And we're certainly willing to have those conversations with state officials, with federal officials, with anyone to help shape the industry. Obviously, I believe there still will be a need because nursing homes provide care that can't be provided in any other setting. I understand that there will be concern about people going into a nursing home or caring for loved ones because of how COVID-19 is attacked. But I think we're certainly willing to work with our members and with members of the federal delegation and local political leaders to shape something that is best for the residents and what they need, as well as our staff.
Scott Fraser, President, CEO of the Rhode Island Healthcare Association, thanks so much for joining us.
Tim, thank you so much for the opportunity. I appreciate it.
And when we come back, a new political poll has insight into how people feel about the governor's job performance during this pandemic. Ted Nesi helps us break it all down. Stay with us. You're watching Newsmakers. Welcome back to Newsmakers. I'm Tim White, and I'm not even quite sure what to do with myself right now. To our loyal viewers of Newsmakers, you know this is a rarity. Political editor and business editor Ted Nesi is in studio. Normally, Ted, you're at the State House getting ready to cover the governor's...
Well, normally I'm in studio, but during the pandemic...
it's the new normal.
We got the band back together for you folks this morning here, playing some of the old tunes.
Right. The governor moved her press conference to 2:30. We're taping this on a Friday, so Ted could join us in studio. This is a studio, by the way. These are cameras
and
lights, just in case you forget
strange. Yeah, this is
how
quite
this
a
works.
setup. Yeah, it's different from Zoom.
But we are keeping 6 feet apart as required. All right, let's get into politics. There's Joe Fleming cheated on us, our pollster and Eyewitness News political analyst. He did a poll for Bryant University, and one of the questions asked was a job performance question of the governor, how voters feel. These were registered voters, right, in this poll?
Yes, yep.
Okay.
Registered Rhode Island voters.
How they felt about the governor's job performance in this pandemic. What were the results?
Well, and I got to say, I'm so glad. A shout out to Gary Sass, who runs the Hassenfeld Institute, that commissioned this poll, because I've been wondering, and the economy being what it is, there's not necessarily a ton of money out there for polling, and so it's great that they invested.
Yeah, we love political surveys.
We love to know, and it gives us the temperature of the voters.
Sure.
So we pulled the numbers again today to tell people. So, I mean, a startlingly high number for Governor Raimondo, in my opinion. 81% of Rhode Islanders said she's done either an excellent job, 44%, nearly half, or a good job dealing with coronavirus. 14% said just fair, and only 4% called her work poor. Now, I say startlingly not as a commentary on how the governor has performed. I think we kind of knew she'd
it's relative.
Some good mark. It's just exactly, Tim. You and I have covered her since she was treasurer, let alone governor. She's never had strong approval ratings. They've always been usually in the 40s, kind of middling. She did win re-election with over 50% of the vote, but we didn't see a big bump out of that in the polling. So, when Charlie Baker gets 80% approval in Massachusetts for coronavirus, well, he already has 70% approval, so it's not a surprise. But this is a sign of Governor Raimondo, clearly, at least in the first month and a half of this crisis, making a good impression on voters who are skeptical of her more broadly. Now, I'm not predicting necessarily it lasts forever or that it flows into other policies. People who disagreed with her on stuff not related to coronavirus presumably will still have disagreements, but it does present potentially an opportunity for her to at least convince some of those people to give her a second look in her second term.
Well, I wondered that too, Ted. As this drags on longer, will people start to sour, on the governor and her leadership, even if it's not directly related to any policy decision making that she's doing at the time? I mean, this isn't the blizzard of '78, where roads were largely cleared after a few weeks. This could go on for months and months. Do you think there's a risk there just by the very nature of this crisis?
Absolutely, and I think it's, we're not in a vacuum in Rhode Island. This is a global crisis, right? So I think that's a risk for every political leader in the country who right now has a lot of public support. The thing is, and the governor has said this, I think in her daily briefings or calls with reporters or somewhere, that she thinks, and I know a number of governors feel this way, it would be better to more slowly reopen the economy so that the cases don't go up too fast and you have to then crack down again. Because I think public opinion, this is me guessing, but I do think a lot of experts have said this, if you open quickly and then the health crisis gets out of control and then you have to ramp down again, I think people would be particularly frustrated to lose something they'd been given back, as opposed to waiting longer to get it back. Just knowing how people are.
So I looked up a WPRI Roger Williams University poll that we conducted in February 2018, again by Joe Fleming. Do you want to guess what her job approval was then?
40%-ish?
Pretty good, Ted. It was 37,
there
61.
You
now,
yep.
that was an election year.
Right.
Going back to the one Fleming conducted for Bryant this week, any crosstabs that stand out on that? We say crosstabs, it's demographics or anything that a certain set of voters where it was particularly strong or weak?
Well, I mean, one piece was just, when you're at 81% approval, you're doing well with pretty much everybody is doing pretty well, because you can't get that high unless a lot of different groups are giving you positive marks. I was struck she had majority approval from Republican voters, a small group in Rhode Island because there aren't a lot of self-identified Republicans, but still notable. And of course, an interesting contrast with President Trump, where only Republican voters in Rhode Island support his handling of coronavirus. So with Raimondo, everyone, including Republicans, gave her a majority support on coronavirus. With Trump, no one but Republicans in Rhode Island are giving him majority support.
What are Trump's numbers overall with everybody in Rhode Island?
So the president,
a very blue state,
47% of Rhode Island voters, nearly half, say Trump is doing a poor job handling coronavirus. That's the worst rating you can give in the poll. And then another 17% graded his work as just fair, so not so hot, though not poor. And then there were 34% of voters, so about 1 in 3, so it's not nobody by any means, but only about 1 in 3 rating his performance as excellent or good. So you have 81% saying Raimondo excellent or good on coronavirus, 34% saying it for Trump. I can't say I was shocked, Tim. As you said, this is a blue state. Trump lost to Hillary Clinton by double digits last time. His approval rating here has never been very high, similar in Massachusetts as well. But you do expect often to see sort of a rally around the flag effect with presidents in crises, and we're not really seeing that with President Trump. He's had some polls where he was up a bit, but clearly the way he's handled this has not given him the kind of bump we saw with like President Bush after 9/11 or the first President Bush after the Iraq War or various other crises. It's not happening right now for Trump.
Well, you remember President Bush had that iconic moment with the bullhorn.
Yeah.
They're all going to hear from us soon. I wondered if, in 2016, you think about the free media, the earned media, we talk about that then candidate Donald Trump was able to harness and really helped propel him to victory. Well, he couldn't be getting more earned media right now, daily press briefings, he's very visible. Is it having that same kind of impact right now going into the campaign?
There are Republicans concerned that the daily briefings are hurting the president politically at this point, that he should be on the air less because those are going on, often 2 hours. It's a time he fights with the press a lot. He'll make statements that are contradicted on the podium by the doctors. All of that, I think people look. President Trump is a great showman and a great.
He's great at rallies.
Great at rallies. He's a great at public relations.
Yeah.
He has a brilliant sort of knowledge of what resonates with people at kind of a visceral level. The problem is that's not necessarily what works best in this. People want the president to come on and give them kind of straightforward health updates, have a sense that he's in command, have a sense that he takes responsibility, and that's just not the way the president sees his role at a media briefing. He sees that as more thrust and parry with the reporters and all of that. And so I think again, there are, even in Rhode Island, 1 in 3 voters saying he's doing a decent job. So I don't want to say there's nobody feeling that way, but 34% doesn't win you an election. He needs to find those middle of the ground voters who are on the fence, maybe considering Joe Biden, and this is a time they're probably taking notice.
We haven't heard from Joe Biden really at all, except for some early kind of cutting, biting political ads about the pandemic. I feel like his handlers are just putting him off to the side.
Yeah, well, he's in the basement in Delaware. We've seen a few live shots of him
literally
down there. Yeah, literally can't leave, his house in Delaware. I think, one thing that Biden has been doing under the radar, he's been doing a lot of local television interviews. Obviously, he doesn't need to go on WPRI because he's probably going to win Rhode Island and Massachusetts, but he's in the swing states doing those. He's done some of the late night comedians. He'll go on CNN. But frankly, polls in the swing states keep coming in with Biden in the lead. So if you're Biden's strategist, they might be saying to themselves, look, Trump seems to be hurting himself by going on TV, and Biden, by quietly just staying as the alternative to him and not making much news of his own, is out there. Generally re-elections are referendums on the incumbent. Right? Every president wants to switch it and make it a referendum on the challenger, but it's hard not to make it that way.
I just wonder if this would be considered a wartime. They've been talking about the pandemic as a war or a battle. That's been the analogy used over and over again. And you're the political editor, politics editor. Correct me if I'm wrong, but no modern incumbent president has lost in wartime, right?
No, that's true. But first of all, that can wear off quickly. George H.W. Bush had 90% approval ratings after the Iraq War, but the economy went south, and by 1992 he's losing. Right? That's why Bill Clinton won the primary, because other stronger candidates didn't run because Bush looked so strong. I also think wartime, coronavirus is a different kind of enemy. It's not a person. It's not a country. It's hard. It's harder to rally people against what is in the end a microbe, right? And it makes it all the more important that people feel like the public health response and then, of course, the economic response. That's the other thing. I mean, we don't have the April unemployment number yet, but they're saying it could be 20% unemployment. People at first are going to understand why that happened, but they're going to quickly want that to snap back, and they're going to get really frustrated if it doesn't.
Well, speaking of unemployment, one of the more frustrating questions that you and I have gotten into 12 Responds has been from people from Massachusetts who are independent contractors, gig economy workers. And they would say, when can I file for the Pandemic Unemployment Assistance Program, or PUA, people are hearing about? And we've been like, hang in there. Yeah. Well, now we finally can say Massachusetts has launched that site. And I just, as we have a minute left here, Ted, the contrast between Rhode Island and Massachusetts. Rhode Island got that up really early.
Yeah, I mean, we don't want to minimize. We hear from everyone every day who's frustrated with DLT, with slow benefits payments, can't get through. So I wouldn't minimize any of that. But I will say, when you zoom out and compare nationally, the New York Times said yesterday only about a dozen states even have the PUA program for self-contractors up yet, which I would say, is less a compliment to Rhode Island than a very bad sign for those states. Those people, that means weeks without pay, which is why the Rhode Island officials said they work so quickly, and in Massachusetts try to get that up and running. So it's good that that's up and running, and hopefully that's getting relief to people quickly, because that's the whole reason Congress created the program.
And we have a link to that program and many others on WPRI.com. Go to 12 Responds, and that's also where you can send a question in. We do see those, and we try to answer as many as we can. I want to thank you for watching, and we'll see you next week on Newsmakers.